Injuries, a broad chapter. Injuries. We will cover all the types of injuries and the questions. We will be covering mechanical injuries, firearm, thermal injuries, which will include your hot and cold injuries. And lastly, we will be discussing about electrical injuries and lightning injuries. Okay. Questions in your PG exams come from these 5 aspects as far as injury is concerned. Okay. So let us first see what do you mean by injury. Injury is defined in law under 44 IPC as any harm done illegally to a person in 4 aspects. What 4 aspects? To a person in his body, mind, reputation, and 4th is property. What do you mean by this term? 2 important things are there. First, this word, illegally word. Anything which is done illegally, that means out of law. To a person in 4 things: body, mind, reputation, or property. Okay. Then you should know the definition of grievous hurt. Grievous hurt. Which is defined under 320 IPC. 320 IPC has been detailed in your IPC section. Okay. So I am not going to repeat it again here. This is available in IPC section. Okay. Let us start with classification of injuries. Injuries are classified based on the type of weapon used to produce the injuries. So based on types of weapon. The classification of injuries is there. Number 1, when the weapon is a blunt weapon. Blunt weapon like your lathi or hockey stick, okay, or any stone. So if the weapon is a blunt weapon, it can produce abrasions over body. Along with abrasions, there can be contusions. And lastly, there can be lacerations. Okay. Then by a sharp weapon like a knife. Sharp weapon like knife can produce incised wound. Then a heavy sharp cutting weapon. Heavy sharp cutting weapon can produce chop wounds. So chop wounds are wounds with gaping. Wounds with gaping. Gaping means breadth is large. So such wounds are called as chop wound. Heavy sharp cutting weapons like your axe or meat chopper. These are said to be heavy sharp cutting weapons. Then your weapons can be pointed weapons, which can again be sharp or blunt. Pointed sharp weapon like your knife can produce incised stab wound. Whereas blunt pointed weapons can produce lacerated stab wounds. So how do you differentiate incised wound and lacerated wound? Very easy. So let us differentiate. Before differentiating, it should be clear in your mind. When do you say a wound to be stab wound? Okay. So stab wound means, like if I write dimensions of a wound as 5 cm length into 0.2 cm width into 5.5 cm depth. Whenever the depth of the wound is more than length of the wound, whenever depth of a wound is more than length of a wound, we say the wound to be a stab wound. And based on the margins of the wound is categorized as incised stab wound or lacerated stab wound. So let us see the differences. Once I am ascertained that okay, this wound present over the body is a stab wound, my next aim will be to look at the features which distinguishes incised wound from stab wound. If I get clean cut margins of the wound, this is possible with incised weapons, so sharp weapons producing incised wounds. Okay. If the margins of the wound are irregular, on the other hand, if they are irregular, I will categorize, okay, this is a lacerated wound. Next point of importance to differentiate between incised wound and lacerated wound is presence of tissue bridges. Okay. So tissue bridges means connections between the two margins of the wound. If a wound is supposed like this, what we look at is the connections. In a lacerated wound, the margins will be irregular with some tissue connections between the two margins. Whereas a incised wound which has clean cut margins, there are no tissue bridges. So no tissue bridges or connections are seen in incised wound, whereas presence of tissue bridges, tissue connections are present here in lacerated wound. So remember these two important points: clean cut margins, incised wound; irregular margins, lacerated wound; no tissue bridges, okay, the wound is an incised wound; presence of tissue bridges, okay, the wound is a lacerated wound. These are the two main points of differences. Bleeding will be more in which type of wound? Obviously, when the vessel is clean cut, the bleeding will be more. So bleeding is more in incised wounds as compared to lacerated wounds. Bleeding more. Okay. Here the bleeding is less as compared to a wound, incised wound of similar dimensions. So remember these three differences. Okay. Now we have classified our injuries. Let us see the injuries one by one. Let us first see the sharp weapon injuries. Sharp weapon like your knife can produce, now we have seen, they can produce either incised wounds or incised stab wound or chop wounds when the weapon is heavy weapon. Coming to incised wound, suppose I have a knife like this. It will have a handle and blade. This blade can have single sharp edge or double sharp edge. So what are the differences between single injuries which are produced by single sharp edge weapon when the single edge is sharp as compared to a double sharp edge weapon. Double sharp edge. Okay. Single sharp edge weapon will produce when it is used to, suppose, cut this part of the body. What will happen? The sharp edge will cut the skin, whereas the blunt edge will produce denting of the skin. Okay. And if I draw a fish like this, what is this? This is your tail of the fish. So this type of wound where one end is cut, other end is dented, this is called denting. This is the cut produced by the sharp edge. This type of wound is called fish tailing of the wound. Seen by use of single sharp edge weapon. To be differentiated from the wound produced by a double sharp edge weapon. What will happen now? If a double sharp edge weapon is used, one end is cut and the other end will also be cut. So the wound will be something like this. This is called spindle shaped wound. Spindle shaped wound. This is produced by double sharp edge weapon. Okay. And when this knife will go into, suppose, your cavities, and when the depth of the wound will be more than length of the wound, we will say, okay, this is an incised stab wound. Based on fish tailing or presence of a spindle shaped wound, we will categorize, okay, the weapon must have been a single sharp edge weapon or a double sharp edge weapon. This is what we do at autopsy when we look for injuries. We look at the margins. Then we simplify, okay, whether a single sharp edge weapon has been used or a double sharp edge weapon has been used. This fish tailing of the wound is one thing. There is a separate term called tailing of the wound. Tailing of wound, of incised wound. This term is used in relation to sharp weapons. By the word tailing, we mean if your wound is properly like this, suppose 5 centimeter length, then at one lateral end, what will happen is only the superficial part of the skin is cut. Proper wound is 5 centimeter with a tailing of, suppose, 1 centimeter. By looking at the tailing, what I can tell is, okay, the knife must have been used in this direction. So tailing of incised wound gives us direction of force used. Tells us the direction of the weapon or force used. Okay. So remember this term. Tailing of incised wound is different. Fish tailing is different. Fish tailing is how the wound will look like when a sharp edge weapon is used. Now let me give you one example. Suppose a stab wound case came to the mortuary. The autopsy was to be done by me. Before starting autopsy, we look at the injuries present over body. Okay. If I get a wound like 5 centimeter into 0.2 centimeter into 6.5 centimeter, I note down the injury as this with clean cut margins. This wound is present over, suppose, abdomen, right side abdomen with clean cut margins. Clean cut margins. What I will write here? This is the incised stab wound. So I will write incised stab wound of this much size is present over right side abdomen with clean cut margins. Okay. Then if the policeman asks me few questions like, sir, can you tell me the dimensions of the knife which might have been used? Police has to recover the weapon of offense from crime scene. But suppose the accused has killed someone and he has thrown knife at a place which he is not able to remember. Now, the police will be in a fix so as to what to comment upon the weapon. So they will come to us. Suppose they get hold of one knife from his house. Now they want to clarify whether this knife is the same knife which have been used to commit a offense. So, suppose police has brought this knife for matching whether this wound, as you have mentioned in your post-mortem report, is possible by this knife. So what I will look at, I will take dimensions of the knife. Which dimensions? I will take the length of the blade of knife. Then I will take the breadth of knife, blade of knife. And then I will also take the width of the blade. Width of the blade. Length of the wound as mentioned. This is the length. This will be produced by which part of knife? This 5 centimeter is going to be produced by your breadth of blade of knife. Okay. Length of the knife is going to produce which thing? Length is going to produce the depth of the wound. Length of the blade is going to produce the, suppose this is the knife. The length of the blade will be the depth of the wound. The breadth of the blade of knife will be the length of the wound. And breadth of wound like 0.2 centimeter will be the width of blade. Simple thing. Keep it simple. Okay. This is what we do regularly. We give opinion for weapon of offenses recovered by police. Okay. If my knife length is suppose 6 centimeter. Knife length is 6 centimeter. Breadth comes out to be suppose 5 centimeter. And width of the blade of knife comes out to be 0.1 centimeter. Then I will give the opinion, okay, the depth of the wound is 6.5. By a knife of 6 centimeter, 6.5 depth is possible. So I will write the injuries present over the body is possible by the weapon of offense given for examination. Okay. If the dimensions of the knife don't match with the injuries, I will write the dimensions of the knife. By measuring the dimensions of the knife, the wound is not possible with the type of weapon given for examination. This is what we regularly do. This question has been asked in your exams. Corroboration of the blade of knife with the wound. Okay. Okay, this finishes your sharp weapon injuries. We have done the differences between incised wound and lacerated wound. Let us now come to blunt weapon injuries. Let us now come to blunt weapon injuries. Blunt injuries. Number 1 is your abrasions. This is defined as destruction of epidermis only. Epidermis only. Okay. If this is your skin, it will have a epidermis, then there will be soft tissues. After the soft tissues, you have your muscles and the vessels in the deeper layers. When there is destruction of epidermis only, we say the wound to be abrasion. When there is, what do you mean by contusion? Let us see. Contusion is also called as bruise. Bruise or contusion is a type of injury where there is damage of soft tissues, vessels. Okay. So, any damage to vessels in soft tissue layer, the wound is categorized as contusion. What is important is the epidermis remains intact in contusions with intact epidermis. Epidermis. What do you mean by contusion? This is the third type of wound produced by blunt weapons like your lathi. Laceration is damage of skin and deeper tissues. When everything is damaged, skin and deeper tissues, everything is involved. So laceration is defined as damage of skin plus deeper tissues. What is important is epidermis is intact in contusions. Damage of epidermis only, the wound is categorized as abrasion. Damage of epidermis and deeper layers, the wound is categorized as laceration. Okay, simple. Let us now see the types of abrasions. First, most common type of abrasions are your grazed abrasions, also called as friction burn or brush burn. Grazed abrasions are also called friction burn or brush burn. These are produced due to dragging effect over body. Dragging effect over body by any means. When there is dragging effect, grazed abrasions are produced. These are most common type of abrasions. Question of All India. Most common type of abrasions are grazed abrasions. Production by dragging effect on the body. Due to this dragging effect, heat is produced, and that's why the names friction burn and brush burn have been given to grazed abrasions. Second type of abrasions is your scratch abrasions. Any abrasion with significant length, but insignificant width. The abrasion is called as scratch abrasion, like this. When the length is significant but the width is insignificant, this can be produced by use of needles or fingernails. Can produce these type of scratch abrasions. Fingernail scratch abrasions over front of neck. Your mind should go, okay, this can be a case of manual strangulation. In manual strangulation, what happens is the assailant puts his hand over the neck of the victim and throttles the neck, producing scratch abrasions over front of neck. Third type of abrasion is pressure abrasions. These are produced due to sustained pressure over body part. For example, ligature mark in case of hanging and strangulations. These ligature marks are a type of pressure abrasions. Ligature mark. For example, like bite marks. Bite marks over body are a type of pressure abrasion because a sustained pressure will be applied by your teeth, producing bite marks. Next type of abrasion is impact. Impact abrasions are said to be, impact abrasions are also called as imprint abrasions. Imprint. For example, muzzle imprint. Can be seen in case of contact firearm wounds. The muzzle end can leave impression over your skin, and this will be a type of imprint abrasions. And lastly, we have patterned abrasions. Patterned abrasions are a mixture of your pressure abrasions and impact abrasions. Suppose there is a moving vehicle. The vehicle hits someone. At the first moment, it will have impact over the body. Okay. Then the driver will apply brakes. Application of brakes will produce pressure abrasions over that part of the body. And due to the involvement of impact and pressure component, the pattern of tire or pattern of radiator grill can be produced on the body. So patterned abrasion is a mixture of impact and pressure abrasions. So this finishes your types of abrasions. Let us now come to the age of injury or age of abrasions. Age of abrasion is important to know the age of the injury so as to when the injury might have occurred. Suppose a person comes to the casualty saying that so and so fellow hit him yesterday. During examination, you find brownish black scabbed abrasion. It is not possible for brownish black scabbed abrasion to be developed in one day. So you will come to know, okay, this person is lying. So age of abrasions is important to know the age of injury. Initially, when the wound is fresh, the abrasion color is reddish. For a time frame less than 12 hours, the abrasion remains reddish in color. After 12 to 24 hours, along with this red appearance, you have a scab formation. So reddish scab abrasions is seen when the injury is 12 to 24 hours old. Now, why scab formation is there in abrasions? This is due to lymphatic channel destruction, due to lymph coming out and drying, due to lymphatic destruction. Lymphatic channels are present in your epidermis. There are no blood vessels, but lymphatic vessels are there. They get damaged. What is abrasion? Abrasion is destruction of epidermis. Epidermis contains your lymphatic vessels. So due to lymphatic destruction, scab comes out and dries up, forming a scab. After 24 hours, the color becomes reddish, brown with a scab. This is seen for a period of 1 to 3 days. Then the color becomes brownish black with a scab. This is seen between 4 to 6 days or 4 to 5 days. 4 to 5 days. On 6th day, scab falls off, leaving depigmented area on 6th day. And so your abrasion heals in about 1 week. Heals in 1 week time. Okay. So this is the color change of abrasion. Initially, when the injury is less than 12 hours, the color will be reddish. Between 12 to 24 hours, the color is reddish with a scab. Between 1 to 3 days, the color is reddish brown scab. Between 4 to 5 days, the color is brownish black scab. This scab will fall off, leaving a depigmented area at about 6th day. So your abrasion heals in 1 week. So this is all about abrasion. You should know. Come to the second type of injury produced by a blunt weapon, that is your contusion or bruise. Let us first look at the age of contusion. Age of bruise or contusion. Initially, when the wound is fresh, so it is said that initially the color is red when the wound is less than 3 hours old. This is due to, what is contusion? Contusion is damage of the vessels in soft tissue layer leading to extravasation of blood. Now this blood will go on degrading with time. So your hemoglobin pigment will change into different pigments will be produced at different days. This formation of different pigments at different time gives us the color of the contusion, and we use it for knowing the age of the injury. So if the wound is less than 3 hours old, the color will be red. This is due to oxyhemoglobin pigment. Oxyhemoglobin. Then the color becomes blue. Color of bruise becomes blue when the injury is 3 hours to 3 days old. And this is due to deoxyhemoglobin. Deoxyhemoglobin presence at the site of wound, site of injury. Then the color changes to blue-black. Blue-black at about 4th day. This is due to hemosiderin pigment. Siderin. Then the color changes to green. Bruise becomes green at about 5th to 6th days. 5th to 6th day. This is due to formation of biliverdin pigment, which is green in color. Some of the textbooks mention this pigment to be hematoidin. But in the recent edition of Dr. Gautam Viswa's textbook of forensic medicine and toxicology, he has corrected this thing, that this green color is due to biliverdin pigment. So remember this pigment. Other books mention hematoidin as the cause, which is not so, which is not correct. Okay. So don't remember this thing. After green color, the color becomes yellow. Color of the bruise becomes yellow between 7 to 12 days. And the color is, this color is due to bilirubin pigment formation. Bilirubin pigment formation. And finally, your abrasion will heal after this phase. So we can say contusions will heal after 12th day. So contusion heals in 2 weeks. Abrasion was healing in 1 week. Contusions heal in 2 weeks, 14 days. Okay. So this is about age of the injury, age of contusion. Let us revise. When the wound is less than 3 hours old, the color of bruise is red due to oxyhemoglobin pigment. Between 3 hours to 3 days, the color of bruise turns blue due to deoxyhemoglobin pigment. This color change is occurring at the site of injury. Suppose there is a contusion over front of wrist, okay, at this part, dorsum of wrist. Then initially the color will be red, then it will become blue, then blue-black, then green, then yellow. On 4th day, the color becomes blue-black due to formation of hemosiderin pigment. Between 5th to 6th day, the color becomes green due to biliverdin pigment. And between 7 to 12 days, the color becomes yellow due to formation of bilirubin pigment. And finally, your bruise or contusion heals in 2 weeks. Okay. Let us now see the types of bruises which are important. Number 1, ectopic bruise. What do you mean by ectopic bruise? Ectopic bruise is also called as percolated bruise. Percolated bruise. This means bruising at a site other than the impact, due to gravity. For example, if the injury is of forehead, if there is fracture of anterior cranial fossa, what can happen is the blood from this part can seep, can gravitate to your orbits, producing black eye. So, fracture of anterior cranial fossa giving rise to black eye or bruising around eyes called as black eye. So, black eye is bruising around eye. The site of impact is forehead or anterior cranial fossa. The site of bruising is periorbital. Okay, this is what we mean by ectopic bruising. Similarly, when there is fracture of middle cranial fossa, that means your temporal bones, what happens is the blood seeps to your mastoid. So, bruising of mastoid is seen. Mastoid is behind your ears. So, bruising of your mastoid seen in fracture of middle cranial fossa is a type of ectopic bruising, and this is called as Battle's sign. Battle's sign. Black eye is also called as, sometimes it is also called as panda eye and raccoon eyes. Panda sign is seen in which disease? Panda sign is seen on gallium scan. It is seen in sarcoidosis. We have panda sign on gallium uptake. But panda sign on MRI is seen in Wilson's disease. So, remember this fact also. Panda sign, panda eye is different thing. This is black eye. Black eye can be produced. One of the mechanism is due to ectopic bruising. This can also be produced by direct impact over your orbits. Direct impact can also produce black eye. But ectopic bruising can also produce black eye. What is panda sign? Panda sign is seen in two diseases, in sarcoidosis and Wilson's disease. In sarcoidosis, we get panda sign on gallium uptake. While MRI of the brain gives us panda sign in Wilson's disease. Okay. So, this is your first type of bruising. Second type of bruises are tram track bruises. Frequent repeat question. Tram track bruise. This means whenever a weapon like lathi or whip, whenever a weapon like lathi or whip is used, it produces tram track bruise, which is, there will be two lines of bruises produced by the edges of the lathi, and the central part in between remains normal. So, what is panda sign? What is tram track bruise? Tram track bruise is two lines of bruises with intervening normal skin. Okay. Two lines of bruises with intervening normal skin. I will show you the photographs and images of all the injuries. Let us first discuss the injuries. Let me acquaint you with the theoretical part. Then after looking at the images, you will come to know, okay, this thing was told in the video discussion and this is the image. Everything will become crystal clear. So tram track bruise is produced due to blow by lathi or whip. And third type of bruising is sixpenny bruise. Sixpenny bruise. These are small, circular, small size, circular bruises over arms or shoulders. These are seen in battered child. Battered child is a child who is constantly being beaten by the parents. Parents, they themselves beat their own children, giving rise to another question, battered baby syndrome. So sixpenny bruises are when the parents catch hold of their child over shoulders and arms. They produce bruises due to this tight hold of the arms and shoulders. So small circular shaped bruises will be produced. These are referred to as sixpenny bruises in case of battered child. So let us finish here battered baby syndrome. Battered baby syndrome. This question came in your All India this year. Battered baby syndrome is also called as shaken baby syndrome, also called as infantile whiplash syndrome, also called as CAFE's syndrome. CAFE's syndrome, to be differentiated from cafe coronary syndrome. Okay, cafe coronary syndrome is a type of choking event where the cause of death is cardiac arrest due to vagal stimulation, due to involvement of recurrent laryngeal nerve. The term cafe coronary has been coined by Robert Hogan. Okay, this we have dealt while discussing your asphyxia part. So CAFE's syndrome is different entity. What you should remember here is one important thing. A child, suppose he is beaten by the mother in the morning. Mother slaps the child over cheek. In the evening, father comes from office. Usually this is seen in a case where the parents are psychotic. Where they are not happy. The husband and wife, they themselves fight all time. So they keep on beating their children, such psychotic parents. So what will happen? The mother beating the child in the morning, the father beating the child in the evening. The age of injuries will differ. Suppose the child comes to the casualty. If I am looking at, okay, reddish abrasions are also there. Brownish black scabbed abrasions are also there. And reddish brown scabbed abrasions are also there. So injuries are less than 12 hours old. Injuries are between 3 to 5 days also. So I will have a suspicion in my mind. Okay, this child can be a battered child. So number one important thing, multiple injuries will be present on the child. And they will be of different ages. Multiple injuries all over the body of different ages. Whatever the injury may be like, abrasions, contusions, the ages will differ. Okay? This is the key point for diagnosing a battered baby syndrome. Questions also common, what is the cause of death in such child? The most important cause of death. So, most common cause of death, COD. COD stands for cause of death. Most common cause of death in battered baby syndrome is subdural hemorrhage. Subdural hemorrhage. These psychotic parents, what they do? They shake their child vigorously. And due to this vigorous shaking, what happens is their subdural veins, they rupture, producing subdural hemorrhage. So this is the most common cause of death. I have done a case where the parent, what the father did, I have done an autopsy of a child, battered child, in which there were multiple injuries of different ages, and the father himself narrated to the police that he used to catch hold of the feet of the child and then he used to rotate the child in a circular manner. This is what psychotic parents do, producing questions. Which questions? Battered baby syndrome, also called as infantile whiplash syndrome, shaken baby syndrome, or Caffey syndrome. Okay. What is the most common cause of death in such child? Subdural hemorrhage. How will you diagnose such a case? Became your question of this year All India. How will you diagnose? Multiple injuries of different ages. Whatever the injuries may be, like abrasions, contusions, they will be of different ages. Okay. So this finishes your types of bruises. Let us now come to lacerated wounds. A wound where there is damage of epidermis and the deeper tissues is said to be a lacerated wound. Let us look at the types. Firstly, we have incised looking lacerated wound. Incised looking lacerated wound. What do you mean by this? This means incised looking, the wound is lacerated wound based on presence of irregular margins and tissue bridges. If there are irregular margins along with tissue bridges, I will mention this wound to be a lacerated wound. But at which place of the body these lacerated wounds will appear to the naked eye? Okay, these are incised wound. Whether these are incised wound, so I will have to cross check by using a hand lens to look at the margins of the wound and to look at the tissue bridges. We use a hand lens whenever there is discrepancy. So, incised looking lacerated wound is possible over which sites? Any part of the body where just beneath the skin you have bony framework, like your forehead. Just beneath the skin, when there is bony framework, chances of which wounds are possible? Incised looking lacerated wounds. Another example is your anterior tibial region. Anterior tibia. Tibial region, also called as shin. So at these two places, incised looking lacerated wound can occur. To be differentiated from which other wounds? We have another category called as lacerated looking incised wound. Looking incised wound. By using a hand lens, I have seen, okay, the wound's margins are clean cut with no tissue bridges. I will certify this wound to be a incised wound. But at which places of the body incised wounds are there, but they will appear as if they are lacerated wounds? So at which places it is possible? Any place of the body where there are multiple rugosities or multiple skin folds, like your scrotum, like your axilla. At these places you have multiple skin folds or rugosities which will produce lacerated looking incised wounds. Then there is a term called avulsion or avulsed lacerated wound. It is also called as, avulsion is also called as flaying of the wound. Flaying. Any wound with a skin flap. Suppose there is a lacerated wound over this part of the forehead and a flap has been created due to the impact by a moving vehicle. Suppose a lacerated wound is here of 4 cm length, 0.2 cm width, and the wound is muscle deep because muscle is getting exposed with a skin flap. I will label this wound as avulsed lacerated wound. So any lacerated wound with skin flap is your flaying of the wound or avulsion of the wound. When the flap has gone, suppose the moving vehicle has taken away the skin layer, I will label this wound as degloving injury. Degloving injury. in which lacerated wound is there because of irregular margins, because of presence of tissue bridges. Tissue bridges role is not there when the wound is degloving wound. Why? Because the skin is itself lost. So any lacerated wound with no skin flap and exposing underlying tissues like your soft tissue or muscle or bone is getting exposed, the wound externally will be called a degloved wound if skin layer is not present. Okay. Degloving injury. So simple, incised looking lacerated wound is seen over regions of the body where there is bone just beneath the skin, forehead and shin. Lacerated looking incised wound is possible over areas where there are multiple skin folds or rugosities like your scrotum and axilla. Avulsion is lacerated wound with skin flap. When the skin flap is gone, we say the wound to be a degloving injury or degloving wound. Okay. Then let us look at some one-liners which are very important from this injury chapter. Number 1 is your, what do you mean by windshield glass injury? Windshield glass injury. This is also called as sparrow foot injury. Sparrow foot injury. This is also called as dicing injuries. This is a newer term. So, all these three mean the same. What is this? These wounds are actually lacerated wounds over face produced due to broken glass particles. In any road traffic accidents, when the windshield breaks, the multiple pieces of the glass particles, they can lead to lacerated wounds, multiple lacerations. So, multiple lacerated wounds over face due to broken glass particles are called as windshield glass injury, sparrow foot injury or dicing injury. Next important term. What do you mean by ladder tears? Ladder tears. In any road traffic accident, if you see transverse tears of intimal layer of aorta, when there are transverse tears of intimal layers of aorta like this, these are called as ladder tears because of their resemblance to a ladder. Ladder tears. Next term which is important in case of road traffic accident is seat belt syndrome. What do you mean by seat belt syndrome? The question which was asked from this aspect was, which is the most common injury seen? What is the most common injury produced by use of seat belts? Seat belts are a protective equipments present in your vehicles, but they can cause damage also. So, most common injury by seat belts is seen in mesenteries, causing damage to the mesenteric vessels. Then you have a term called chance fracture. So, seat belts lead to chance fracture of which vertebra? Thoracolumbar vertebra. Thoracolumbar vertebra. So, fracture of thoracolumbar vertebra can be produced by seat belts, and such fractures are called as chance fractures. Then there is a term called tailgating. Tailgating. motorcyclist hitting a heavy vehicle like truck. A motorcyclist is hitting a heavy vehicle like a truck, and due to this hit, when there is decapitation of the head, if there is decapitation, it is called as tailgating. Tailgating is decapitation of a motorcyclist due to hitting the motorcycle to a truck's posterior. Okay, hitting a heavy vehicle from posterior side. This term is used, tailgating, which refers to decapitation seen in motorcyclist. Okay. So after these one-liners, let us quickly revise the one-liners. You should know what do you mean by windshield glass injury. This is also called as sparrow foot injury or dicing injury. These are multiple lacerated wounds over face due to broken glass particles. Then you have a term called ladder tears. These are transverse tears of intimal layer of aorta seen in road traffic accident. Then due to seat belts, you can have injuries to the mesenteries, most common injuries. You can have a chance fracture of your thoracolumbar vertebra. Tailgating is decapitation seen in a motorcyclist when he hits a truck's posterior. Okay. Let us now finish your types of skull fractures. What are the different types of skull fractures? Number one and most common is linear fissured fracture. Linear fissured fracture. If your skull is like this, if you have a single fracture line running over any part of the skull, it is referred to as linear fissured fracture. These are most common type of skull fractures. Most common. Second type of skull fracture is depressed fracture, also called as signature fracture. Why they are called signature and why they are called depressed? Depressed fracture is produced due to blow by heavy weapon with small surface area. Heavy weapon with small surface area. For example, hammer. If you apply hammer over your head, what will be produced? What can be produced? Externally, you will have abrasion like this over one part of the scalp. When we remove the scalp layer, what we will see? We can see, if this is your skull vault, what we can see? Underlying your circular abrasion, what we can see? Fracture of the skull bone like this. And this fractured part depresses, goes deep. So, what is the importance? You can correlate the weapon of offense used by looking at the depressed area. This is the importance. Weapon of offense can be correlated. That's why this type of fracture is called as signature fracture. Its signature, matches with the weapon of offense. Third type of fracture is gutter fracture. Gutter fracture is due to bullet injury to skull. Bullet injury to skull. Seen in firearm cases, whenever the bullet grazes your skull bone, it produces a gutter, so called as gutter fracture. Gutter fracture is due to bullet injury to skull, where grazing of skull bone is seen. Grazing of skull bone occurs. Okay. Next type of fracture is hinge fracture or motorcyclist fracture. If I draw your base of the skull, this is your central foramen magnum seen at the base of the skull. If a fracture line runs along the base of the skull, dividing your skull base into two equal halves, okay? One half will be your anterior half. This is the anterior part. This is the posterior part. So, a fracture line dividing your base of the skull into two equal halves antero-posteriorly. The fracture is called as hinge fracture or motorcyclist fracture. Starts from petrous part of the temporal bone on one side and goes to the petrous lateral end of petrous part of temporal bone on the other side. Okay. So, fracture line dividing skull base into two equal halves antero-posteriorly is called as hinge fracture or motorcyclist fracture. Then next type of fracture is pond fracture or indented fracture. Indented, from the name itself it is clear, indentations occur. Indentations will occur whenever the skull bone is soft, like in children. So, pond or indented fracture is due to soft, pliable bone of children. Soft, pliable skull bone. So, even by the use of thumb over skull bone can lead to indentation of the skull bone in a child. That fracture will be called as Pond's fracture or indented fracture. Next type is comminuted. Comminuted means multiple fracture fragments seen. Multiple fracture fragments of skull bone. And lastly, we have diastatic or sutural fractures. Diastatic or sutural fractures. Any fracture line running along sutures, skull sutures, is called as diastatic or sutural fractures. So, fracture along skull sutures. So, remember the important types. Most common type is linear fissured fracture. Then you have depressed or signature fracture, where you can correlate the weapon of offense used to produce the injury over skull bone. Gutter fracture is due to bullet injuries to the skull bone. Hinge fracture or motorcyclist fracture is fracture line running along base of the skull, dividing skull into two equal halves antero-posteriorly. Antero-posteriorly. Pond or indented fracture is due to soft pliable bones of children. Comminuted fracture means multiple fractured fragments of the skull bone. Diastatic or sutural fracture is any fracture line along your skull sutures. Okay, this finishes your skull fractures.